I call to order this regular meeting of the Board of Health for April 9th, 2019. Please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Good evening, everyone. Welcome to the Board of Health. Citizens' time. Is there anyone in the audience who is not on the agenda who has any issues or concerns to bring before the Board of Health? The chair will postpone the subcommittee report until the application is discussed. So this is not, this has been before on. Applications. Application for site plan approval and special permits, 328 to 330 Cambridge Street.
Record. I'm Frank DiPietro, an engineer with the BSC Group.
Welcome back, Mr. DiPietro.
Thank you.
Christine.
The applicant, which is Iconic Capital, is proposing to raise the existing building that's located at 328 Cambridge Street. The entire site plan also includes 330 Cambridge Street. There's been some history at the site, historical use as a piggery, as a lumber company, automotive and motorcycle repair shop. There is also currently a cell tower that will remain on the site. We had a subcommittee meeting with Mr. DiPietro and the LSP of record for the site. There are some areas of concern with regard to potential environmental contamination. There's been a limited subsurface investigation, and we've asked for additional sampling and analysis to be performed once the building comes down. And I'll let Mr. DiPietro give a site overview.
Good evening again, Frank DiPietro with the BSC Group representing Iconic Capital. We're looking at the site at 320, 330 Cambridge Street. Historically famous for the Reed Farm Works, going back from the 1830s to the early 1950s. Perhaps the most significant landmark is Makash's and the florist right on Cambridge Street right here. Route 62, Wilmington Road is here. This is Chestnut Avenue, and across the street is County Road. This is the existing building here that used to be the electric company, the lumber yard, whatever. The cell tower is here. This building, which is 336, is not part of this application, although I understand there's an application pending for some work on this before the planning board, others. And then there's a small shed area over in this area right here. What we're looking to do, just to sort of, again, reorient, this is existing conditions. This is that existing large building, Chestnut Ave right there. The cell tower and that small building, that's the 336. So what we're looking to do is to, wonderfully complex colored plan, to basically keep the cell tower but raise the rest of the structures on the two sites, 328, 330, put in a one-story, 21,500 square foot office building that will be used by a state agency. We have originally proposed 85 parking spaces, which is what the state agency said they need. We have been before the Conservation Commission, the Planning Board. We've had a subcommittee meeting, as was mentioned, with the Board of Health, and a subcommittee meeting with the Planning Board. As a result of those meetings, we've made some modifications to the plans that were originally submitted. These were submitted, I think, the 28th of March or somewhere in that range. Among those are that we're looking to land bank. We're asking for 3 permits, 2 special permits, one the typical man-made discharge to a wetland from the site. The second special permit is a request to increase the parking ratio above the 3.0 that's allowed under zoning. And then the third is site plan approval. So in our discussions with the planning board, we're now looking to land bank, maybe in 2 phases, some of the parking spaces we've asked for on the site. So there's an area here of standard size parking spaces. We're looking to land bank those if the planning board allows us to. That'll be 14 spaces. We will have permission to hopefully build it later on, but that will be based upon a review by the building department and the planning board as to the need, demonstrate the need for those. Yes.
Quick question, what does land bank mean?
Oh, sorry, okay, so, we have the town has a policy on occasion, not all the time, that if you need more parking, they'd rather you don't build it right away, but you have the design approved, you have the permit to approve it. Sometimes it's graded out, and it's left as a permeable area, grass or whatever, and then when the time comes, you've already sized your drainage system, you've already included all the parking in the pervious areas in your original design and in your drainage system to handle it. And all you need to do then, once you get permission, is to build the parking, so you don't have to go back for any permitting and stuff like that.
Okay, so it's kind of in reserve.
Exactly right. So, so these 14 spaces would be phase 2, if you will, the second phase. There are another 6 spaces back here that we would ask for, again, to be land bank, if they allow. That gets us down to the 65 parking spaces that were allowed under the zoning. So essentially, we'd have 20 parking spaces that could be land bank, depending upon what the planning board decides, and would meet the 65 spaces. The other change we made was, in discussion with the planning board, they didn't like the fact that we had about almost 30% compact parking spaces. So we went back in and sort of reconfigured the site a bit, and we ended up in the 85 spaces having 3 compact spaces, that is an 8-foot by 15-foot, 47 standard spaces, 5 handicap spaces here, and then we use what's called modified compact. They're wide, 9-foot wide, which is a standard 9 by 18 space, but they're 15-foot deep, so it's wider to get in and get out of. So the remaining spaces would be the modified compact spaces. That configuration of parking is shown on this plan. There was some concern, we have an access off of Chestnut Avenue here. We originally were gonna have this as an in, one way by the building to the back of the site, 2 ways coming out onto Cambridge Street, the left turn, right turn. Again, the planning board had concerns about that, particularly if people coming down the afternoon trying to take a left turn onto Cambridge Street, crossing the oncoming traffic. So, again, at the request of the planning board, we've now made this a one-way out, so that when people want to go southbound on Cambridge, they go down Chestnut Ave, cut onto Wilmington Road, and then go out at the light. Those are the layout changes. In our discussions with the
So,
subcommittee.
wait, I'm sorry, can I, so I actually live in this area, so,
Okay.
so the one-way street is leaving, is where?
Okay, so
One-way exit?
we have a one-way, a 14-foot wide driveway here. Originally it was one-way coming in.
Yeah.
At the request of the planning board, it's now one-way going out.
Okay,
So that there are 6 spaces here, so people could come in from Chestnut Ave in the morning and come in here. They couldn't do that in the morning. They'd have to come in off of Cambridge Street and cross into the site. At night, those folks who want to come out and take a right onto Cambridge Street, that's relatively easy, once the traffic's backed up from Bill Ricker here,
yeah,
which happens. But that would be an easy one. And to minimize the turns of people taking a left onto Cambridge Street, the vehicles back here could go one way out here, take a left onto Chestnut Ave, coming out of the driveway, head down to Wilmington Road, and then either go down to Wilmington Road, sort of northerly or west of, on Wilmington Road, or take a right and go out to Wilmington Road and take a left at the Cambridge Street signal.
because Chestnut Street
One way.
is unique in that area. If you leave the LaCasha's parking lot, or the Florist parking lot, yes, you can make a right and go the way, but you cannot make a right coming off of Cambridge Street
That's
onto
correct.
Chestnut Hill.
Right.
So
yes.
I'm trying to think of how so is that exit from the, and this is just for my own edification, so thank you for being patient, is the exit from this site, across, pretty much across from where the exit is from the Florist area onto Chestnut?
Not quite. So the exit we're looking at it's right beyond the bus stop.
Yeah.
So if you sort of come out of the Florist,
Yeah, yeah.
it's just about a little bit south of the bus stop.
Okay.
There's a couple of exits later on and farther on down the roadway here. But that exit is sort of right about here, so it's near the Chestnut Ave exit that we're proposing, which is about where the Chestnut Ave exit is right now to get onto the site.
Okay, okay.
The Cambridge Street exit is farther up, and it's really almost opposite County Road. So, you know,
I
we
mean,
would, as this is a state Mass DOT state controlled highway, when we're done with the town, if we get our approvals, we will be going to Mass DOT to get an access permit.
so I'm just concerned, this is where the bus turned, I think the 352 or the 350.
Right, there's a bus
turns there
stop
as
right
well.
over here. This is the end of that island. So there's a one-way sign, you can't go, well, I've seen people, you can't go down theoretically, Chestnut Ave, heading southbound. You can get out this way. That's the bus stop. Right now, the bus is parked sometimes blocking the
Yeah.
access into either one of these two sites, the landscape area, this one here. And officially, the bus is right over in here.
Okay,
So where is whatever they use that building for? Used to be a florist shop. I think it's a contractor now. Where is that on that picture?
that's 36.
It's gone, so
What?
we're gonna
Oh,
get.
that's part of what you're
Yeah, the
taking
whole
down.
building, existing building
No.
will be taken down.
It's not part, no, I'm not talking about that florist.
You're
I'm
talking about the
talking
other-
about the
you're
other
talking
florist.
about the
other one. No, that's still
down the
there.
road.
That's still there.
Florist over
But-
here, I think
It's
a bunch
next
of
door.
flowers.
Yeah,
Will be
given,
here,
or
Wakasa will
something.
be here.
It was the bike shop when
Okay,
he
so
had
this,
electric.
yeah,
that's
so
right,
this,
that's right.
this one-way road is between the current building
Florist.
where the electric place was and where the contractor florist, whatever building
Yes,
is.
the landscape-
It's really a driveway, right?
If you
Right,
put
it's
up
really
your
wrong.
Google map,
It's
that
still
would be
there.
help me.
Okay,
but-
Yeah,
Yeah.
And you
I
guys
do want to
have
go
that-
back to that, though, after you're done,
You
Mr.
guys have that
DiPietro.
also.
So, again, to sort of orientate folks, this is the gas station right here.
Right.
This is Wilmington Road, 62, Cambridge Street. Chestnut Ave sort of is in a little bit of a loop going south. This is Chestnut Ave at Wilmington Road, and then as it gets on to 90, Cambridge Street, this is County Road. This is the existing building right now. This is the landscape contractor. that's
Okay.
sort of next to that. Lakasha's is here, the florist is right over in here.
Gotcha.
Their access is here, and they've got driveways here, there's a little office building over in that location.
And the other floors is in 36, or was in 30.
There was this wing of the existing building
Okay,
where the
okay,
florist was
got it.
located, and I think she lived up here.
Yeah, great, okay,
Site,
thank you.
sure.
Mr. DiPietro, can you go back to that? Because I want to talk about the land bank, and I know
Yep.
we can probably do this afterwards if we want, but, so when you came in front of the subcommittee, we talked about the fact, because you had a detention pit basin proposed, and we asked you to expand the discharge, underground discharge, and eliminate the basin.
Right.
So talk about the land bank for the future parking spots. Are you still increasing the
Yes.
discharge? Okay.
So, I'll get to it, but I'll
Yeah.
show you more when I get to the.
Sure.
So we had proposed a bioretention area here
Mm-hmm.
that water flowed into, then overflowed after it infiltrated the ground out to the wetland. We've eliminated that, we have a new drainage line from that area that ties into our infiltration basin, which is located here, which has been expanded to handle that additional flow from this area. So there's no bioretention basin. Everything on the site everything from most of the site, the building, it goes into this infiltration basin, and we have reductions. It varies from storm, but anywhere from 30 to 50% of the peak flows from existing.
Yeah, I guess my concern was, even though you're not finishing the parking spots up there, you're planning for the future of it, so that if they do decide to finish those, the underground
Right.
water discharge.
So when you say infiltration basin, is it actually an open basin?
No, it is an underground.
Underground.
Typical pits you see, they're plastic or
Yep.
whatever else,
Yes.
the water goes in. It is treated prior to going in. Okay. So we have the drainage from this side of the site goes into a water quality unit and then goes into the infiltration basin. In our discussions with the conservation, we had two water quality catch basins. They're not exactly up to DEP standards, so as a result, we converted these to standard, typical deep sump catch basins and have added two water quality units here. So almost all of the site flows into this infiltration, except for this area here. There was some concern expressed by the Conservation Commission that they wanted to maintain some direct flow into the wetland area, so they didn't drive it. So this area here goes into a catch basin, water quality, and then discharges. And then the overflow from the infiltration system ties in and also discharges into the wetland. The vast majority, again, anywhere from 30 to 50% of the runoff from the site goes into the ground, and back into the wetlands in that way. There was some concern expressed that We were by some of the abutters, that they found their backyards over the years getting wetter. I was at the planning board hearing, so what we did is we made a 6-inch deep little depression here, in this grassed area, and the water flows into that and then overflows. It infiltrates into the ground, overflows over the sidewalk into the Cambridge Street drainage system, which is what that area went into Cambridge Street right now. So we're not changing the flows in that way there, but again, just a very shallow depression. We're very much aware that Board of Health does not want to have anything that's deep that could be a drowning hazard. So a very shallow area, just holds a little bit of the water and then allows that to flow into the Cambridge Street drainage system as it does right now.
Are you good with that?
So that's a change
That's
as
a
well.
change.
So-
That's a change.
Again, that was pretty much based on the input we got from the abutters that were at the planning board and also some of the planning board folks at their hearing.
Well, I'm a little concerned, that's by the sidewalk, right?
Yes, it would be.
By the sidewalk, and you said it's 6 inches?
Right, there's a relatively, it's wide area, as much of the flat area that we could, we didn't want to make it too deep. The water flows into that and then would seep into the ground, and the excess would be retained in there, and then at a higher storm, maybe a 10 or 25-year storm, there would be some runoff over the sidewalk into that area.
So isn't there a catch basin, if I remember correctly, on that side?
Yes, so there's catch basins, there's one right over here, an existing catch basin, there's one farther down here. So this grades back to the existing catch basin over in here.
So why would we want any water to be coming over into the, especially during, if it's going to cause ice? You know, if overflows, it freezes, you're gonna have ice in the whole area. Why would we want that? We just went to court with some people over the fact that they're icing the whole area around the street. It's gonna overflow into the catch basin, but the whole sidewalk's gonna be ice.
That was a request, again, that came from the planning board folks.
I'm
because-
sorry, I mean, this board controls the drainage, the sewerage, the environmental. That's all. We haven't talked about the environmental. Drainage and sewerage is our purview. The other issue is, for some reason, this plan is being talked about all over the community. You know why, we know why, and that's because the proponent doesn't want to tell us what's going to be there. It's going to be a state agency. And we talked about this at the subcommittee, so no, and you still can't divulge what that is. But in talking to people, I'm thinking, you said there was not going to be a laboratory,
Correct.
which includes a DNA situation, our DNA. How about animals? Are there going to be any animals there?
My understanding, though, there'll be no animals.
I'm talking about the housing and animals, I'm not
Right.
talking about, support dogs or whatever, okay? Is it going to be a healthcare or a food establishment? Either of those. If it's a food establishment, we need to talk about that ahead of time for external grease traps. So we have to talk about that. I don't know if did we talk about external grease traps in the conditions? No, we didn't. Is it gonna be,
The floor plan that I've been given by the architect is for an office building that might have an area comfortable, where people might sit down, bring in their lunches, but there's nothing being cooked there. There's no cafeteria that you'd be able to make.
so there'd be
dinner
no
or lunch.
public health issues being, that are gonna come up due to the purpose of this building?
I don't know the use, so I can't tell you.
So I think that needs to be a condition.
Yeah,
And-
I agree with you.
And last, I mean, is this building, again, it's only, usually we don't go into this, but there's so much conversation in the community, and I've been asked, will this building need the occupants or the use, will the public be safe by the use and by, of the people or the use of the building? And I think that's another issue that I keep being asked, And this would have never come up if you told me, yeah, it's gonna be the Department of Environmental Safety, the Department of this. Will the fire department have any issues based on what's gonna be inside of this? That's another issue. Or the police department. I don't know, and this keeps coming up over and over again in questions to me and questions to other members of the board too.
I mean, I've certainly after the subcommittee and after other meetings, I've brought this to the attention of my client, and he has directed that he's not, at this point, not available or not able to identify what the tenant is. It is not something like an RMV, it is not certainly a food processing, it's not a Bureau of Prisons or anything like that that
And all I'm saying is, you're being so cryptic about this, is I need to make sure that what we passed today, and as always, and I will say you did a beautiful job on much of the, but we have to talk about that indentation, but also the issue around some of these things which I'm being faced with, and I know you're being
Yep,
faced with.
I agree, and I think that you said this, I was thinking, it seems like a lot of things have changed since your subcommittee, so we haven't, I mean, we're hearing it tonight, but we haven't had a chance to review. We reviewed what you've submitted.
Yeah, I think,
from the
we expressed our
subcommittee.
concerns at the subcommittee, I think you addressed them, but adding any type of standing water to the property, I wouldn't be able to support today, so.
I wouldn't either.
So there you go. We need to talk. All I'm saying is, we just had a huge problem on Fox Hill Road about water coming off of property on the sidewalk, on the,
Well, it goes without saying, this is a heavily trafficked area, there's a bus stop right there, the folks look, I would not support anything that would allow for any water to overflow onto the sidewalk or any public area.
Our original grading, if we have to change this, looks like we may have to, we'll go back to the original grading we had, which we had all that area going in to the drainage system. It still has the capacity to take it. It would not be a major issue to modify this grading to meet that.
and that's just, it's such a busy area. I'm thinking of ice. We've had so many problems with ice. We just went to court for some residents who had the same issue where water flowed off their property onto the sidewalk and onto the
Just onto the street.
onto the street, not the sidewalk, thank you. And caused all kinds of problems there. And you have a bus stop right there, right on the, see, there are a couple of issues here that I want to add to the conditions, and I don't think that it's going to in any way, shape, or form interrupt what you're trying to do, but I need to know, that any issue that involves public health or protection or safety of the community needs to be addressed, at least from the Board of Health, in some type of a condition.
Director, what are your thoughts on this?
Well, I was just thinking perhaps we can continue this to our next meeting, and we would probably want to meet with the planning board, is that correct?
Yes.
At a subcommittee meeting with maybe some planning board members and the Board of Health to come to an agreement on that?
Sure. I mean, we certainly
I mean,
can
we've-
address anyone's comments.
Our decisions have not been based on who is going to be occupying a building.
Right.
But we need to make sure that the building offers no disruption to the health of our town.
And
So,
it's, if you're gonna go back to the original grade in that little area, the current update to the stormwater report was not clear that there would be overflow into Cambridge Street.
Okay.
Because I wouldn't have let that come here.
No
Yeah.
problem.
Because
No,
I've spent months on another condition just up the road,
To avoid
ice
that.
on the sidewalk into a catch basin,
And if you
it's
have
been a-
capacity, that may end that pretty quick.
Yes, it's not an issue.
Yeah, so if we,
I have no problem once you change that. I have no problem with the environmental. I think he addressed pretty much all of your concerns.
Yeah, except now, I'd like to more in detail understand the steps for this land banking.
Yeah,
Once we
I-
approve the permits, what does that mean? What can they do without having to come back in front of the board, if any time, right? I need to
Was that part
understand
of your
that.
subcommittee
No,
discussion?
that was gonna be finished as part of
Okay.
the subcommittee.
That's right.
Okay.
So, again, it was at the request, I think, of some of the members of the planning board, both at their public hearing and at subcommittee meeting. So what happens is the design is based upon the full build.
Sure.
So drainage, impervious areas, zoning, whatever else is based upon the full build out. And I can't speak to what a new condition, but the conditions I'm familiar with in the past would be that a certain amount of the site would be built with the capacity. Maybe you build the drainage to here, for example, and then it's just a connection on this area, however that works out. But the conditions usually have some wording to the effect that the applicant would need to demonstrate the need for the parking to the satisfaction of the building commissioner and the planning director. And then, provided it matched what had been originally approved, it could be constructed as approved.
Without any further permitting?
That's correct.
Okay. So, and I don't know, the Director of Public Health and Environmental Engineer, in terms of our concerns, is that within our purview?
Well, if the land banking or the addition of parking spaces at a later date would cause some kind of drainage problem or issue, then yeah, I think it would be our concern. So that's really kind of what we would be.
And then the other piece of the purview is do we need to know what's gonna be there to build in anything to the plan that would allow us to say something about the approval? For instance, I don't know we don't know anything. I asked about a laboratory, Mr. DiPietro was no animals. Do we need no food? We know we don't need a grease interceptor. Is there anything else? I just threw this out, and I don't even know it's in our purview, because we usually don't ask this, but is there anything else? I'm thinking back when the ice,
I was just gonna say, the
When the
last time a state agency issue came before us,
it was in
it
ice.
was
I remember that very well.
it was a
And
highly contested issue.
and they worked it out with us. Other than the fact that they called the protective barrier planters. I don't know if you remember that.
Yes.
And we took a lot of heat over the planters. Do you need planters here?
No, again, I can't speak definitively, I'm sorry about that, but
I understand that, but you see what I'm saying. I'm saying I want to approve, if it needs planters, then it's okay, but I want the planters up. But I don't want to approve this if you don't have planters, which are security barriers. That's all I was, I don't see anything wrong with this at all in terms of drainage, sewerage, environmental.
Drainage has to be worked out.
Well, the drainage has to be worked out, and I think you verbalized that. But I'd just like to know what any barriers are.
to my knowledge, we have not shown any barriers on here. There is as part of the application, there is a floor plan. It is just a very generic floor plan that shows office space.
Yep.
And some conference rooms.
For 85 people
Yes.
or more.
My understanding is that would be the maximum, but again, I don't. know
Because
the
they may
details
have
here.
clients coming in and going, right? Is that what,
There may be people coming,
Yep.
they have,
that's what I'm
my
reading.
understanding from what my client said is, his client, the state agency needed 80 parking spaces for staff and 5 spaces for visitors. So there's gonna be some kind of coming and going
Go.
on.
So I think at least formally, we need to take a look at the drainage. And informally, whatever, you can ask your proponent, do we need those types of things there?
I will be happy to do that.
Full transparency is always better, right? So,
Yes, I understand that.
Yeah.
Had this discussion.
And you know, we're fair.
yeah.
Yeah,
So do we need a motion to
I was just
continue?
gonna say, do we need a motion to postpone?
Sure.
Two other items, if you wouldn't mind.
Sure.
So, one of the things that was talked about, I'll go back to the area, with the planning board is, and with the neighborhood, is a sidewalk along Chestnut Avenue, basically from Wilmington Road, tying into the existing sidewalk. We're gonna be rebuilding the existing sidewalks across our frontage, but we've looked at, and I've walked the area, we have not done a survey, so I don't know exactly where the right-of-way lines are and stuff like that. And so, what the proponent has agreed is that they would be willing to put a sidewalk in. It's a typical, according to the engineering folks, to be bituminous concrete with vertical granite curbing, 4-foot minimum wide, would have to meet the handicap barriers access. The issue is we've got 3 trees, 1, 2, 3 trees that, in my rough measurement, probably would, if they remain, would not allow us to meet the handicap standards. So, while it makes a lot of sense to have a sidewalk on the Alma Road side for people to go back and forth, you know, depending upon what the town would want, we could, in fact, put a sidewalk on the other side. There's a lot of driveways in that area there's some other areas. This would be a preferred, but again, if we have issues with the Shade Tree Act, we may have to do something different. We would propose to the planning board, and just want to make you folks aware, that the proponent will be happy to work out the deal, do the survey, do the design, fund the construction, but the town would need to sort of figure out what they want to do, and depending on what the survey showed, if there was any land takings needed, they'd have to address those. Again, the minimum would have to meet is the standards for the handicap accessibility for the sidewalk.
It's
Mr.
not-
DePietro?
So,
That's not part of our purview.
I'm just curious, what is the Shade Tree Act?
Every, I think, 24 inches, I forget, or 18 inches, every tree in Massachusetts over a certain size has to have a public hearing before you can cut it down, if it's within a right-of-way, public way.
Okay,
And I haven't seen it here, but sometimes they have to post the meeting,
okay.
and they usually post it by sticking a nail in the tree and the posting thing on the tree that's gonna be cut down.
Okay,
Um,
thank you.
And again, supposedly, the tree warrant officer, which I believe is John Sanchez in Burlington, would have to hold a public meeting at the tree essentially.
All right,
So,
thank you.
again, it's an old regulation, but it is in effect.
Thank you.
Does Iconic Capital currently own the building, or so the permitting so the sale is contingent upon getting the permits?
Yes, that's my understanding. And the folks who bought it, who I work for, they were gonna do a self-storage facility.
Right,
I've now changed their minds, but I guess they got a better offer and stuff, and so they're gonna sell the property. It is contingent upon getting the permits, to my understanding.
gotcha, thank you. And just one question, I think when we were at the subcommittee, we talked about doing a full phase 2 ESA, and it looks like the conditions are written just that we're getting some slab samples.
Sub-slab samples, that's what
Right.
we agreed upon.
That's what we agreed, okay.
Ultimately at the subcommittee, yeah.
Okay, all right, thank you.
So this has changed a little bit since the subcommittee.
Well, just that little drainage area,
We need a motion to,
To continue.
continue.
Chair will entertain a motion to continue after further deliberation.
Mr. Chairman, I will make a motion to continue discussion on the vote for application for site approval and special permit 328, 330 Cambridge Street.
second.
Motion is second. Is there any further discussion? Seeing none, all in favor?
Aye.
Pleasure. Mr. Petro, we value your time. We thank you for this.
Yeah,
There's
thanks for
some things to iron out.
Okay.
So,
Okay.
but thank you very much for
We're
your time.
close.
Thank you so much.
Sure. Thank you folks for your time.
Thank you.
Thank you, staff, thank you.
Variances, the Okey Poke Restaurant, 19 3rd Avenue, external grease interceptor. Welcome. Come, please sit and relax and sign in and give us your name, please. And Marlene.
Mr. Zhang is before you this evening. He's going to be opening a new restaurant in town at 19 3rd Ave. It's formerly the Bedford Farms Ice Cream Shop. So there is not an existing external grease interceptor, so he is before you tonight to request a variance. I did enclose his menu. He doesn't have a lot of fog that he'll be generating. So my recommendation to the board is to vote to approve the variance from Section 4, Part A, and allow the new food service establishment to operate without installing an external grease interceptor with the following condition. The food service establishment operator and the property owner both understand that this variance may be subject to revocation, suspension, or expiration as determined by the Board of Health. A variance under these regulations may be revoked, modified, or suspended only after the food service establishment has been notified in writing and given an opportunity to be heard at a regularly scheduled meeting of the Board of Health. Reasons for revocation, modification, or suspension of a variance include, but are not limited to, a determination that the food service establishment is discharging grease in quantities sufficient to cause sanitary sewer line blockages or increased maintenance of sewer lines.
Mr. Zhang, well, we're very happy you're here in Burlington. Welcome. Tell us a little bit about you're being watched by our communities. Tell us a little bit more about your business, and then Dr. Weiner has some questions for you.
So basically, it will be a Hawaiian and Japanese concept. The only item that which on the menu will be the chicken, which we only use probably 1 to 2 spoons of oil a day. Just the chicken moisture. Everything else will be frozen. Make sure everything is fresh. And we talk about the grease part, right? So basically, we do have an internal grease trap inside the building currently, which I'm occupying an existing restaurant spot left by Bedford Farm, which was an ice cream place.
Right. Menu looks delicious. Dr. Weiner.
I had a couple of questions, a number of them. First, you've worked with interior grease traps before,
Yes,
and you know you need a log, and you need them cleaned out on a regular basis,
yes,
and make sure that the log is filled in appropriately. Second of all, I might ask questions about this, since there is also a variance around the acidification for sushi rice.
yes.
How do you do that? Do you do that with paper, or do you do that with a pH meter?
We do it with the paper currently.
You do that with a paper?
Yes.
Is that appropriate? I know you say that that's okay, but
It is, as long as they have the papers that can go down low enough for the pH reading, which he does.
which he does,
Yes.
okay. And the question is, where do you get your sushi fish? Is it already frozen, or do you have to freeze it to rid the fish of parasites?
Is it sushi level fish that you're serving, or is it, because you have organic tuna, and or is that sushi level?
Oh, the
Fish?
organic tuna came in frozen, but the salmon itself, we have to slice the skin off, preserve it in a frozen tray to make sure there's no parasite.
So
I mean, we're mixing motions here.
okay, so I won't, I'll go back to that, but now you are at least.
So now you're primed for further
Fine
discussion.
for further discussion, all right.
So you understand about maintaining a log, and we take that very, very seriously here. In fact, we're gonna be talking about an issue where that was not necessarily done and there was a problem. So we just wanna make sure that you have that. Any questions regarding the internal grease trap variant, or the external grease trap variance for Mr. Zhang?
Just, Mr. Chairman,
Please.
just, do you currently own restaurants
I do own one in Westford too.
in Westford? And how long you been in the restaurant business?
I've been in the restaurant business for 16 years.
Great. Thank you.
So this isn't your first rodeo, so. if you
Mr.
do-
Chairman, I move
Please.
that we approve approve the variance for, I guess, an external grease trap interceptor.
Correct.
Second.
Motion and second, is there any further discussion? Seeing none, all in favor?
Aye.
5-0, wonderful, okay, now, variances, the Okipoke Restaurant, 19 Third Avenue, acidification for sushi rice. Marlene.
So, Mrs. Zhang is before you for a variance to use acidification. So the document that I have before you explains background on acidification, the HACCP, which is Hazardous Analysis of Critical Control Point Plan Compliance, which I reviewed, and I received a report from the laboratory with the pH of the rice. So what they do is they make the rice exactly according to the recipe, which they'll be making that way each time in the restaurant. It's taken to a laboratory, and that pH was 3.98. So as long as they're making that exactly that same way each time, then we know it's going to be below the 4.6 pH. As well as he will be testing each batch, or his staff will be doing that. And a copy of the pH log was provided and approved as well. So my recommendation to the board is to approve the variance with the following conditions 1 through 9. And Mr. Zhang did receive a copy of this, so he's aware of those conditions as well.
Okay, so We know he's using litmus paper, we know all of that now.
Now, the one question has to do with, and it's not there, about the salmon, you say. You have to slice the salmon and then you have to freeze it?
Depending, yes, mostly yes, because it came in with a crushed ice, and we have to freeze it first before actually we're really gonna serve it.
So you said you always have to do that, is that correct?
Not necessarily, because a lot of sushi restaurants are now purchasing farm-raised. So if it's farm-raised salmon, it does not
have
have
to
to,
do it.
because there's no parasites, because they control what
And
the
you will
salmon
only be
eat.
using farm-raised?
Yes.
Okay, all right, he answered the question. It comes in frozen, the other fish comes in frozen, and you're only buying farm-raised?
Yes.
Okay, I'm all set, Mr. Chairman.
The chair will entertain a motion, on the variance for acidification.
I'll make
I'm,
a-
go ahead.
no,
I move we approve the variance for acidification of rice for Oki Poke Restaurant.
I'll second.
Motion and a second. I would only say that we take this very seriously as well, so maintaining that log is crucial. Any further discussion? Seeing none, all in favor?
Aye.
5-0. Welcome to Burlington. We're very happy you're here.
I'm happy to be a new member.
Wait, when are you opening?
It's a poke concept. So it was it was started in New York. Now it's moving toward Boston, and so it's like Hawaiian and the Japanese, like a half and half type of.
When do you open?
When's the store opening?
You're on television right now. Lots of people
Wait.
are watching you. Tell us
I
about
want to
your,
get deliciousness.
we want to know when you're open and what do you serve?
Hopefully I'll be open. I'll be going away for 4 weeks, but hopefully it will be open before June.
Before June.
Excellent.
Very
Awesome,
good.
great.
Thank you.
Warm weather.
Welcome.
Well,
Beautiful.
good luck.
Thank
All right,
Yes.
thank you.
Darlene's been very helpful to walk
She
me through
is.
everything.
Yeah. She always is.
Yeah, just don't get on our bad side.
Yeah. Keep your logs.
Very good.
Thanks for coming in.
Thank you. Discussion, Community EMS Program, Lieutenant Saya is here, Coordinator for the Burlington Fire Department. Welcome, Lieutenant Saya.
Thank you, good evening.
Director?
Yes, so Lieutenant Sayer is here to discuss the DPH OEMS Community EMS Program. He would like to submit an application on behalf of the fire department in collaboration with the Board of Health to work together in a partnership to do various programs in the community. So this is something that we've been doing all along. We have collaborated with the fire department on various programs. One of them is Stop the Bleed. But this would kind of formalize that process.
Lieutenant
So I'll
Saya,
let.
you have the floor.
Lieutenant-
Great, thank you. Thanks for your time. Good evening, and thank you, Susan. So, as Susan had mentioned, we think that we have a great relationship and partnership, the fire department and the Board of Health. And we're already performing a lot of these activities, health and wellness activities throughout the town, and would like to expand on it. And all EMTs and paramedics in Massachusetts are licensed under the Office of Emergency Medical Services, which is under the Department of Public Health. And about a year ago, OEMS passed an initiative referred to as Mobile Integrated Health. And this MIH program is encouraging EMTs and paramedics throughout the state to work with their local boards of health and to go out into the community and promote health and wellness. And what it's saying is that OEMS is now approving that EMTs and paramedics can step off of the ambulance and go out into the community, and their license will cover them to their scope to go out and perform these activities to promote health and wellness within the community. Currently, the Burlington Fire Department, our medical oversight and direction is through Leahy Hospital and Medical Center, and they also would have to be part of this application, and they have already are very much in favor of it.
I have a question.
Please.
What are some of the things that would be an expansion of what we already do? What are some of the programs that would be offered at this?
Right, absolutely. So it's in your packet, and so we're, as Susan mentioned, we're already doing a lot of it. We are doing Stop the Bleed. We are doing Before Help Arrives, which That has been an extremely popular program the last couple of times we've run it. But we would like to expand to do more on Narcan training for the community and for family members. We'd like to expand on the vaccination clinics, the vaccine clinics. And there's part of this, this mobile integrated health is actually going out to people's homes, trying to keep them well, making sure they're taking their medications, do blood pressure screening, and actually keeping them out of the emergency department.
Interesting.
So South Carolina, I think, or it was North Carolina, one of the Carolinas, had a program where EMS would respond to someone who had had a fall, categorize the fall under 3 tiers. Tier 1 and Tier 2 were considered non-traumatic, did not require transfer, worked with the emergency department and the primary care physicians to have follow-up, et cetera, but were able to reduce transfer and burden in the emergency room significantly. So part of this packet includes fall risk assessment. Are you guys, and so this was very, very successful in this one community and talked about a lot actually in our world. Is this something you guys are thinking about?
Yeah, sure, and thanks for bringing that up. So the mobile integrated health actually has 3 components to it. And it's community, EMS, health and wellness, which is what this application is, which we would like to start. The other 2 tiers to the program is mobile integrated health and mobile integrated health with ED diversion. And so eventually, there is this is an application, mobile integrated health is a license, mobile integrated health with ED diversion is a license. The license application right now is quite costly. However, that isn't something that we have completely ruled out for down the road. For right now, we would like to start with something that we know will work and something that has already proven that we're already doing in collaboration with the Board of Health. But yes, that is absolutely a component of this.
Yeah, so we've talked about it at Leahy for quite some time, so.
I just have one thing to add to that. One thing that I would like to work on as a new initiative would be bleeding control kits. So right now, Region 4A-B is working on getting funds for communities to have bleeding control kits at AEDs. So I'd like to work with Mark to try and get those kits and put them at the AED locations in our public, or at least at the AED locations that the Board of Health has, which we have 6 AED locations in town.
So does the OEMS develop the curriculum? Or how do these programs get generated?
So there is already curriculum in a lot of the Stop the Bleed program,
Right.
which was the Hartford consensus, and so there's already a lot of pre-established. But as far as if for example we did a Narcan training, we would have to develop it and it would have to be approved by OEMS.
Okay, now would that be a fire department job, or is it a collaboration between Leahy, the Board of Health, and the fire department?
It would be a
or-
collaboration, but the local EMS provider in the community, which in Burlington is the fire department, would submit the application to OEMS for approval.
Okay, yeah, I understand that kind of a process, but I just wondered about how the curriculum came to be, and I'm a nurse, so, I look out for the nurse kind of at the Board of Health and what her role would be, and not to exclude her.
Oh, no, we've been working very closely with Chris, and her and I actually have been brainstorming a lot.
Good.
About things we'd like to do.
Great
So I
collaboration.
think Denver had, kind of was the main, or one of the first communities to use EMS in some of these programs, but they purchased vans or something like that, so it wasn't an ambulance rolling up to somebody's house, for obvious reasons. And these vans they're identified, whatever, but they're not ambulances. So is the plan to have some sort of alternative car ban or something for making these visits for these community
Sure.
service projects?
If we were to go with so it's not required for the community EMS programs, because that's gonna be more like us holding seminars and classes in places around town. If we were to go and actually start doing evaluations on residents, there is language in the mobile integrated health application that talks about what the vehicle can consist
Yeah,
of
yeah,
and
yeah, okay.
and what it would be. And you know, and like you said, and it is not to replace 911, but
Because
it is to.
you can go in the house and say, oh, no, we need 911, and that's a whole different story.
Exactly.
Mr. Chairman.
Please.
The Burlington Fire Department, its chief, Steve Yetman, the command staff, and all of your firefighters have been so good to this town and so good to this Board of Health. You come to our flu clinics, you come to all of our programs. I think the community knows that when that happens, the fire department does not charge us, they show up. We have run programs over the many years that I've been on this board together. I'm very proud that we're going to do this, and I want to thank you, Lieutenant, for bringing this to us. And I'm very much in favor of this, and very much proud that we're going to be working even closer.
Thank you so much, and we're very much looking forward to it. I think this is really exciting.
Thank you.
I think it's a great
This is just
idea.
an agreement of the board to continue.
No votes
This is a
needed.
Yes,
formal.
yeah.
Yeah.
Yeah, just to enter into the, to complete the application. I
So,
can sign
so we need a vote.
No, it's just an agreement.
Just
as
an
a board to-
agreement?
to-
Yeah.
I think we should take a vote, I really do. And it shows formal support.
Then would you entertain a motion?
Yes, I move that the Board of Health enters in with the fire department, the Burlington Fire Department, for the community EMS program.
Second.
Very eloquent.
I know.
I know.
Motion and a second. Is there any further discussion? All in favor?
Aye.
5-0.
Thank you.
Yes.
Thank you.
Thanks for coming in, this
Thank
was
you.
awesome.
Wonderful.
Thanks.
Thank you very
This
much.
is great.
Director, would you be so kind as to introduce to the board and to our community our new Board of Health Administrative Assistant?
Sure, so Sarah, come on up. So this is Sarah Quartermanch. She's been working at the Board of Health office now for probably over a month now, a little over a month. And she's doing a great job, and you requested for her to come here. She's gonna tell you a little bit about her background and what she's been doing and how she likes her position.
Talk into the microphone so everybody can hear you.
We're thrilled you're here. We wanted to meet you. We wanted the town to know who you are. So tell us a little bit about yourself and what brings you, how you're enjoying your new position.
Sure. I'm actually very much enjoying my new position. I love everyone in the office and outside of the office as well. I have been an administrative and office support staff member for various companies for about 12 years now. So I have a lot of experience that I could bring to the table that kind of a little bit here, a little bit there of everything. And I also was passionate to come to this position because my father is actually a firefighter, so I have a passion for health and safety. So it was one of the things that kind of drew me to this position. So I'm very excited to be here.
Wonderful,
Awesome.
wonderful. Just heard she said she loves the office staff.
Well, how can she not?
No, I think that's impressive.
I'd like to add that we love her too, and she's doing a great job.
Thank you.
Well, we are thrilled you're here. We thank you for coming in tonight, taking the extra time. But I thought it was just important that we all know who you are, because actually you walk into the office and you are the face we see. So you are the initial representative of the Board of Health. So we thank you for that.
Thank you very much.
Welcome, thanks for coming in.
Welcome, Sarah.
Welcome.
Thanks.
Director, would you introduce, and I'll let you choose, one of the Board of Health interns?
Okay, so I'll start with Matt Jafari. He's been interning with us now for about a month or so, and I'll let you tell him, he can tell you a little bit about himself, and he also has a presentation here he's gonna
Oh,
give, some information on the things that he's been working on so far.
Welcome, Matt, the floor is yours.
Hi, good evening. My name is Matt, and I'm getting my master's in public health at UMass Lowell. And I'm currently in my second year, so I have 2 more semesters. And I do apologize for being a little late. I was at the town annex hall. I thought that was where the meeting was. I was there at 6:50, and I was waiting for a half hour.
And you want to be our intern?
So that was your first test. But please, sit down, relax, you're among friends, and, no, wonderful. So, what is your interest in, is this something you're required to do from your program, or is this an interest that you have that supplements what you're doing in your program?
Both. I'm very interested in the field of public health, and also it is part of my capstone. So my professor said that you have to, for your capstone, do any internship that is related in the field of public health. So that's where I chose to come here. I was very, I liked all the people that I've met here so far, and very warm and welcoming. So, and
Do you love them? So you used a very important word that's used a lot, and people don't necessarily understand what that word is and why it's important. What is a capstone?
capstone, it's pretty much an internship, to the best of my knowledge that I know, and it's pretty much getting a hands-on experience at what you're doing. So, as a result, I'm actually creating an electronic poster, which I will be presenting to, I'm doing this PowerPoint for you guys for the board. I'm presenting my electronic poster to all my professors that I've had, that are at the chairman of public health and the vice chair and everyone that's there in the public health department.
Wonderful. Proceed.
Thank you. I was wondering if I could get the Wi-Fi.
Oh, you're up there, Matt. You're all set. I have you.
Oh, okay.
You just let me know when you want me to advance it.
Okay. I didn't get the Wi-Fi for that, that's why, so, thank you. So, yeah, so this is my, when I came here, Susan had me started working on the logistics of the health fair to begin with. And in terms of contacting the exhibitors, that was my first step, getting on the phone, calling multiple organizations. I tried to aim for nonprofit organizations because I thought they would have more interest in promoting public health without having to come and promote their business there. They'd be more interested in spreading a public health awareness. I tried my best to target diverse health applicants who they would represent different branches of health and public health. So my goal was to try to get like the health fair this year a lot more, introduce a plethora of different fields in there, so it's not repetitive over the course of each year. So I aim for the most crucial sectors of public health that I thought need to be addressed, like the opioid crisis and looking at vaping, look at mental health, fields that as I've gone over currently in all my classes, that my professors in each one, starting all the way from my intro to public health courses all the way down to my upper level courses, they keep on saying these are the fields that need to be addressed over and over again. So that was what I did for the exhibitors. And so for the layout of the health fair, Susan told me that she wanted this year to have the tables be set up back to back, all 6 feet tables. That was actually a result of going through the surveys that we've had from previous years, saying that, oh, like we all prefer to have, well, why did like one exhibitor get a bigger table than we did, or why was it set up differently here? Why did it have more space to work with, and so on and so forth. So she made me told me that I should set them up on the map as it is back to back. There were some raffle vendors that had to be set up on the sides of the room, so because they were the ones that I thought we need to have more room to work with, other than the exhibitors themselves who were not doing any raffles. So far, at least up to my knowledge, we have currently like 5 demonstrators and 2 speakers. This is not finalized yet. I did this close to a week and a half ago, so that was up to that point, up to date as it was. And as of that time that I did it, there was 39 exhibitors coming as of the week of March 25th.
That's wonderful.
We're up on that, so now, when we just looked at the map today, we have about 46.
Wow.
And what's new this year too is the speakers. So we have Margie Taylor from PARI coming to talk. Reach is gonna be there, talking on domestic violence. And we have someone talking on dementia. So at in the wooden gym area, there'll be half an hour talks on these 3 different subjects, running from 11 o'clock until 1 o'clock.
Wow.
Wow, that's great.
Yeah.
That's fun.
And how many exhibitors did we have last year?
Last year, we had probably around 43, 44. I'm expecting more though, because they always come last minute.
Last minute, yeah.
So we set it up so that we had a little bit extra room, so we can hopefully fit
Sneak
some more
some in.
tables in.
That's great.
Yeah, if we need to.
And so, for this year, like each year that goes by for the health fair, I think we've been doing the health fair for about 4 or 5 years currently, and this is the 5th year that I think we're doing it. And we're always looking to increase the attendance, but the question is how. So according to the surveys that I looked at from previous years, they said they would like to change the location of the event from, as yearly is held at the high school, and they want to change it because last year 18% replied that it was just an average location for the health fair. So they haven't really touched upon how we're gonna change the location yet, but that is one thing that came up. Also, the location of the booth and the booth space, 14% this is all from last year's survey, they replied that it was a poor location for the booth space. So we have to speak further upon that. And demonstrators felt that their overall experience was average. Really, most of them, when they further expand on their comments, they just said that mainly that they would like to have a bigger room and perhaps a little bit have the time on their own hands, not having us determine how long they get to do their demonstrations. They want to have that completely in their own control. So that was for the attendance. And also, what I noticed from based on the other aspects of the surveys was that we need to attract younger people and families. Most of the population that are coming to these health fairs were either like 40 years and above, especially like seniors or families that brought their little children. The age groups from 15 to like 29, 30 was very low, close to none. So I think that's really important to address. And then we have to ensure that all vendors have access to Wi-Fi. Last year, some of the vendors said they didn't know what the Wi-Fi password was, and they had trouble gaining access to some of the employees that were there to get the Wi-Fi password. So some of them were delayed in doing their demonstrations and doing their exhibitions. And we need to accommodate vendors with tags. Last year, I don't know if this was the case, Susan, but I think some people said that wasn't a requirement to have tags. So that was one thing that I thought to make it easier for both the visitors and the exhibitors is to have the vendors have tags. And then we need to increase the diversity of exhibitors and demonstrators. Some of the responders in the survey said that we don't feel like we've had enough diversity in that, which is why I highlighted that earlier, that we need to make sure there's at least like one representative from each public health field there as much as we can, not have like 2 or 3 of the same. And
Wait, can you dive into that a little bit deeper? What do they mean by diversity?
like have different sectors of the public health field there, not like I remember going through some of the master exhibitor contact lists from Susan. We had like a lot of dentists that were on the list.
Oh, I see what you're saying.
Like a lot of physical therapists, a lot of like dog therapies or acupuncture, and so what I tried to do was try to update the list and add as much different types of fields of public health in there to add to like our health fair to make it more interesting.
I understand.
And so
Oh, that's great.
And you did get some new vendors.
I did get
You were
some new
able to get
vendors.
some new vendors this
That's
year.
great.
So yeah, can't see the last.
Oh, it's rising concerns in the community, organizations that talk about rising concerns in the community.
Oh yeah, so they want, so based on the, again, some of the respondents on the survey, there was some of them that said that there weren't enough representations of different public health fields that would talk about what the needs that need to be addressed in the community were. There were just some people, some organizations that came in there and talked about, oh, well, yeah, so it's important to like brush your teeth, or like important to have stress management, or things of that nature, not addressing the Burlington community health needs as much as we would like to. We don't have enough of those organizations that are there, so. And after working on some of the health fair logistics, the second objective that Susan had me working on was organizing data for vaping and e-cigarettes, and then later on the flu. The first one that I worked on was the vaping and e-cigs, and I did the frequency of the pass and failures for each, for the previous years from 2014 to 2017, and then from 2018 to present, where I believe there was a new compliance check law that was passed.
New tobacco regulation.
New tobacco regulation that was passed. So Susan really wanted me to look into those two types of years. And what I found out was before that new tobacco regulation was set in place, a lot of like food marts, gas stations, they got a lot of failures, from 1 failures to 2 failures, and there was some that had even greater than 2. But when the new tobacco regulation was set into place, there was none of them had greater than 2 failures, and a lot of them had 0 failures, and a few that had 1 or 2. So I believe that new tobacco regulation that was set into place definitely did help out to have more passes in the compliance checks.
But we do have a lot less data, so we need to collect more data to kind of see how this would.
Yeah, but this is extremely, I think it can be extremely powerful on the benefit of changing the policies. So that's great, wonderful. It's nice to see it in that picture form.
Yes, so for this one, this was the list of all the establishments that the Burlington Board of Health did these compliance checks for. And what I found interesting was mostly the food marts and the gas stations had the highest rate of failures, mainly because a lot of these food marts, they would hire minors to come and work at their establishments, so they would have easier access to tobacco products. And a lot of gas stations, they were experiencing very low profit in their business, and compared to previous years, when I looked at years from 2014 all the way till now, and as each year went by, the gas profits went down each year. So they had to find some other way to increase their profits. So what they did was, a lot of gas stations, have like convenience stores that are there, and those convenience stores, they sold like vapes and e-cigs. So that's pretty much that for that. And yeah. And so for the second data set that I was asked to look at was the flu, and this shows a graph between the years and the number of vaccinated individuals, and this shows an age distribution. And what I found interesting was that a lot of the majority of the population that was vaccinated was from 30 to 64 years of age, and the reason why that population had the greatest amount of vaccinated individuals was because they are the majority of the working population. So they're either required to get the vaccination, or they want, or when they get the vaccination, they voluntarily can go in because they're the most likely to be immunocompromised, because they're a lot of stress that they have to deal with at work, and so they want to be protected as much as they can possible. And a lot of the for the 6 months to 2 years, and especially like 3 years to 18 years, had the lowest rate of vaccination for them for that age group, because a lot of parents did not want their children to be vaccinated, mainly for 3 reasons. One was because they thought if their children got vaccinated, they would get autism as a result. Some parents thought if their children got vaccinated, they would become gay. That's another thing. And then the third reason was because they thought if their children got the flu shot, they would get even more sick. So they had like a superstitious belief about this. And actually a fourth reason that I remember going through was for religious reasons, because some of the strains that they put into making the vaccine came from pork, and some of them did not want their children to be injected with that type of vaccine.
Now, is this data from the Burlington experience?
No.
This is
Oh, okay, I was
national.
just, yeah, thank you.
No, so this data is just
Or
showing
state.
who we vaccinated.
Okay.
We don't know anything about the Burlington
Okay.
Oh,
population.
so it is Burlington
clearing
data
that up.
numbers wise and,
This
The
here
numbers
is
are not the-
Burlington Board of Health numbers.
okay.
So I guess the interesting question for me is, the 19 to 29-year-old population is vaccinated the least, apparently. I'm not including the 6 month to 2 year, because those are handled by pediatricians and stuff like that. So if we have this, if we say that this data is true, love to know what the outcomes are on that population for getting the flu.
I'd love to know what it.
So if the 19 to 29-year-olds are not getting vaccinated, let's just make that assumption from this. Let's make the hypothesis they're not getting vaccinated. What is the outcome? Are they getting the flu? Can we make a play to increasing 19 to 29-year-old exposure to the flu vaccine by looking at whether or not this population is getting the flu?
Or it could be that population just isn't coming to the Board of Health to get their vaccine.
Yeah, so.
Right.
You would think it's
Right, 'cause
a
this is from
sample,
the-
right?
Might, yeah.
Yeah,
maybe.
I think that's very interesting.
But it's hard to
personally.
get reliable data because not all, cases of flu are number
No,
one
yeah, I
tested,
get it.
number two
No,
reported,
I
so,
get it,
you
I
know,
get
it's
it.
kind of
No, I
funny
get it.
when.
It's just,
Must be some
it's
stats,
interesting.
though, I would think.
I mean, I
There
think.
are, they publish
But
them
this
all
is
the
based
time,
on
but-
the Board of Health.
Yes, and what has, I mean, the good thing that's come out of this is that we discovered that there's inconsistencies in the way that the nurses over the years had collected the data. So now we have it set up so that we collect the exact same data every year, so that we can make comparisons from year to year, and that we do it consistently.
Do you get reports from the state as to how many flu cases we have in Burlington?
It's not
I mean, is it
specific
that
to
fine?
Burlington, no.
Okay.
I mean, we get data through Maven, but that's
Right.
only laboratory confirmed.
Right, well, but you do,
But
they
we
do
do
let you
have,
know.
so
the lab-
we know how many influenza cases, and we could break that down by age group,
So, oh,
you know.
Okay.
So usually, I don't forget what the number was last year, but we do get that information
so how many did we get reported? I'm just curious.
through Maven.
Yeah,
I don't know the exact number off the top of my head, but
Okay.
usually it's around, it's in our annual report. It's probably around, I don't know, 80 or something like that.
so it's a real small fraction of the number of vaccinations we give out.
As far as how many confirmed cases we see.
But this is a very complex issue here. First of all, nice job, thank you. It's a very complex issue. When did we receive the vaccine? Some years we receive it later than other years. Some years we receive it earlier. If we receive it later, the numbers go down because people can just run around to any of the pharmacies here and get vaccinated, and we have no data from them, and I don't know if they'll even give us that data. We have a lot of physicians. We have Leahy Clinic in our community, and they require everybody who works for them. They're the largest employer in Burlington, and everybody who works there gets their vaccine there. So this is a very complex issue, hard to look at, but it's very interesting who we see that receives it. Maybe we need to do something about the 19 to 29-year-old people in this community. If this is all based on the fact that if everybody gets the flu vaccine, nobody gets the flu and they don't spread it. So it's in everybody's best interest that we vaccinate everybody, or that they have the ability to get vaccinated elsewhere.
So I have a question about the health fair. When do we survey people?
When?
Yeah.
So when people,
Survey visitors.
so when they come in, if they choose to, they can get free raffle tickets, and we get their email address when they do that. So then after the health fair is over, I send out a survey monkey through email to everyone who came that day, and, we get a small percentage that will respond.
Is there a question on there, did you find this beneficial, something
There is something along those lines.
along those
Yeah,
lines?
yeah.
And does the response generally come back? I mean, I'm forgetting, because
Yeah,
I know you've shared it with us.
Yeah.
But
We've gotten a really good response from the public on it, that they did, I think some of the questions are, did you learn something new? And then there's ratings. So we've got really good ratings on it in the past. I could, provide that for you again,
Okay.
the survey if you want,
I
from
missed,
last year.
I'm interested in kind of outcome metrics from doing this, that we're actually,
Using it to improve.
yeah.
Yeah.
That it's actually doing something of benefit for the community.
Yeah, and a lot of times, we have people will say, well, I'd like to see this, or I'd like to see that. And we try to get those people to come, but sometimes we're successful, sometimes we're not,
I think the classes that you offered last year and,
The
that pulled-
demonstrations?
Yeah, I think that pulled in some younger crowd. That's what I saw when I was there.
Yeah.
I know younger,
I think
my
we
own
did
children.
get a good
Yeah,
span
yep.
of
I
age.
mean, that was like high school, young adult age I saw. They were excited about I don't know if we
Yeah.
have that this year, but that was great.
Yeah, we are having the demonstrations
Great.
again.
Yeah, that was, I think that really pulled in a younger group.
Wonderful work. Are you getting out of this what you're hoping to?
Yes, this was my first ever capstone experience, believe it or not. So I really, ever since I came, I started in mid-January, and all the way up till now, I've learned a lot from everyone that's working in the public health department, from Suzanne, Marlene, Christine, Chris, Samantha. Everyone is just great. I'm learning from different aspects of public health, and it's great to see everyone doing their job so well. And I'm learning how to work hard and be diligent in what I do. So.
I mean, everything you're experiencing is unique. These are unique things to Burlington. Burlington's disaster drill for the flu, it's unique. We have our MRC, it's unique. The health fair, unique. Other things that we have going on, unique, and it's basically because of what these folks have done. So thrilled that you're a part of it, and hope that you're getting as much bang for your buck from doing it as we are from your helping us to do it.
Absolutely, no, it was a great honor to be here tonight. I never thought I'd be here until Susan told me a couple weeks ago, oh, by the way, I want you to come to the board and present what you've done. And I was like, oh, well, I was nervous and excited.
And you're on camera.
Some of us,
You're on TV.
some of us do instill anxiety. But no, thank you very much.
Thank you very much.
Thank you,
Nice
this is
job.
great,
Luck
yeah,
in school.
fantastic, good luck.
Appreciate your time. Thank you.
Yeah,
Thank you.
Director, would you like to introduce the other Board of Health intern to the Board of Health in the community?
Sure, Neil, come on up. So this is Neil Pandit. Neil is a high school student. He just started this week in his internship. And he's gonna be working on the health fair. He's going to have a table as a Board of Health, because Matt actually can't make it to the health fair because that's his day of graduation. So let him out
What's
of
more
it.
important?
Saving that time too.
So Neil's gonna do the project.
Well, clearly
For the
Matt
intern.
has his priorities. So Neil, we're thrilled you're here. We're not putting you on the spot or anything, but, you know, tell us what interested you about the Board of Health and what brought you to us.
Well, I've always been involved with the BVRC MRC chapter because I've been a member of it with my mom, who also volunteers, and I've also photographed many of the events, and I've also been able to take advantage of the CPR and AED training and the Until Help Arrives training as well.
Wonderful.
And as you and Dr. Weiner know, I'm the president of the Medical Careers Club at Burlington High School, so that has interested me in volunteering at the Board of Health.
And he is a master photographer, and I hope you bring your camera to the fair.
Oh, yeah.
I've seen some of the work you do, it's just amazing.
Thank you.
Yeah, that's wonderful.
So
Is
Neil's
the Medical
project,
Careers Club going to have a booth?
as far as I know, I haven't heard from them, so I don't think they're going to. We did reach out to them, but they didn't put in an application.
Oh,
So,
The majority of Medical Careers Club members are seniors, and at that time, seniors are out of school almost, so, no one really wants to.
Do anything extra?
so you're saying that the seniors have some sort of infection, perhaps? There's a term for it, I believe. Yes.
Matt's interested in medicine, we've talked, and it's just, thank you so much for,
so Neil is also gonna help out with
And I know
the
that-
shelter
I'm sorry,
drill
Neil also.
preparation.
Wonderful.
Yeah, so, and his project is gonna be, what's your project for
On
the?
antibiotic resistance.
oh,
Wow.
fabulous.
He's also interested in biotech, so he's gonna do some hazmat inspections with me. At some of our hazmat.
You're definitely getting your bang for your buck.
Yeah,
That's
Thank you,
wonderful.
Matt.
That's wonderful. Thank you for being here and being part of it.
Thank you very
Wonderful.
much.
Thank you.
Thank you.
Thank you.
We're honored to have you, both of you, thank you.
I'm going to take license and save the reorganization for the end of the meeting, if that's okay with everyone, so we just can finish the meeting. Is that okay? All right. So, Christine, environmental engineering report? Please.
Reminder that household hazardous waste is this Saturday, April 13th, 8:30 to noon, at 41 Francis Hall Avenue, the Francis Wyman School. Please do not bring latex paint. I just wanted to give you an update on there was a grease release at Wendy's, and Marlene and I did a co-inspection after it happened, and I went back again to make sure that the remediation had been completed, and it in fact had. So they cleaned all the surfaces that were affected, they removed some shrubbery that was affected, they pulled up dirt areas and mulch areas that were, layered with grease.
How does that happen?
There was a valve that failed in the tank.
Got it.
So there's a float valve, a float that triggers a valve to tell the people, set off an alarm to tell the people that it's full, and that float failed. So it came out the pressure relief valve.
I understand. Okay.
So they didn't get the warning that it was full. The other update I want to give you is that Susan and I went to district court last week and on the matter of the sump pump issue, and the resident was ordered to pay their fines. So hopefully that will put that to bed.
Questions for our environmental engineer?
Yes, I have one, Mr.
Please.
Chairman. The importing of fill for residential properties, You went over that with John Luther, and tell us a little bit about that. I think that needs to be,
Well, there's a regulation or bylaw, that's overseen by the selectmen, and they typically do it require a fill permit on larger, like, commercial properties. And, apparently also for large residential, large quantities that are being imported, they're also implementing that now.
and they need a permit.
To my knowledge, yes. I don't know what the threshold is. I'd have to inquire with the selectman's office about that.
Thank you.
Yep.
If there are no more questions for our financial engineer, the chair will entertain a motion to approve her report.
So moved?
Second?
Motion is second. Is there any further discussion? Seeing none, all in favor?
Aye.
Thank you, Christine. Health agent report. Good evening, Marlene.
Good evening.
I have to tell you, I'm a little surprised that a long-standing, very good, respected business had an issue with their grease trap.
Well, I have to elaborate on that.
Please.
Because I found some interesting information, which I think that maybe
This
DPW was a
is
little...
what we talk about all the time.
Right,
and so this
DPW
is
might have been a little too quick to point the finger.
Great.
So just to give you the backstory, as you might recall, we had a similar complaint, and that was in June of 2018. So when I did the investigation at that time, I found that the restaurant manager was not having the internal grease interceptor pumped and cleaned on a regular basis. He was waiting for his warewash sink to back up, and then he would call for service. So
And this is the same establishment?
this is the same
Right.
Chinese food restaurant. So at that time, he was ordered to contact his grease vendor and set up a routine schedule. And so he did that, and he was on this every other month schedule, and that was what was recommended by his grease vendor. So when this complaint came in, I went down to do an investigation, and his only violation was that he didn't have his log. I ordered him to provide me invoices, so I could actually see the invoices, and he did provide those to me, and he was having it pumped every other month. Now, I went out there on this investigation, it was the 25th of March. The internal grease interceptor was emptied January 30th. The external grease interceptor, which is, it's an above-ground unit, holds maybe about 700 gallons, that was pumped in February. While I was there on this investigation, I said, would you open the grease trap for me? I want to see what's in there. And he didn't have a lot of grease in there. It was about maybe an inch thick. So if there was a backup, I would expect to see the internal grease interceptor filled with grease. I would also expect that the external grease interceptor would have been close to needing to be emptied, or maybe missed being emptied, but that wasn't the case. So there was an email that was sent to Susan that she forwarded to me, something about jetting. So some properties, they have manholes, clean out manholes on their property, and so they're responsible for that. So if an establishment has their drain cleaner come out and jet that can push grease into the main sewer system. So perhaps that happened. There's an Indian restaurant there, there's Dunkin' Donuts there. So all I can tell you is that when I did this investigation, the only violation was that he didn't have his grease trap
So
logged.
how did the other department, Marlene, make the determination that it was this establishment? What did they use to determine?
Yeah, I believe that they are the only ones on that line.
Okay.
So the line that was jetted is a private line that runs behind, but the jetting, I think, happened after the fact. It's possible they could have jetted it prior to, and everything was kind of pushed down the line. So I think that this is one that we need to keep an eye on. And if this happens again, then perhaps we want to consider bringing them before the board and having them do the pump outs a little bit more often.
Okay.
But Marlene, you feel that the only issue that they didn't manage appropriately was just keeping logs.
That's
You
what I
do feel like
found.
they're cleaning out on a regular basis there?
That's what I found.
Okay.
Exactly. yeah.
So I think that just goes to show the caliber of our board,
Yeah.
that we investigate.
Sure.
And we don't draw conclusions that haven't been vetted. So thank
Thank
you for
you.
being so diligent in that.
Sure, sure. Okay, and then the other thing I wanted to mention is that I have scheduled the annual swimming pool operator seminar, and it is going to be held on Wednesday, April 17th. It's for the folks who run the commercial swimming pools in town, the hotels, the clubs, the condos, the apartment building complexes, so.
So I have
The
some
invitations went
interesting
out.
news, or interesting information that I think you might find valuable. If you smell chlorine at a pool, it does not necessarily mean that it is chlorinated appropriately.
That is
I think
correct.
we've heard this for 8 years.
I think we
Oh,
have.
only 5 for me.
Just wanted to make sure that you were aware of that. Okay.
Mr. Chairman, on the subject of chlorinated, I see that the flotation tank issue is back in the news.
Well, I actually took a webinar, and they were, it was pretty interesting, and they were talking about different things, different regulations, because a lot of these are now coming to different states. And they were talking about the disinfection, they were talking about circulation, filtration, cleaning, they're talking about biofilm. There's something out there called the Model Aquatics Health Code. It's similar to what FDA does with the food code. So it's pretty new. They just came out with it, I'd say, maybe about 4 years ago. So they're trying to do what they're doing with the food code, and every 2 years, make amendments, every 4 years, do a whole new code. And so they're hoping that states will look at this and pull some of these regulations and form their own. And there's a big section in there about the flotation tanks too, so, and I'm hoping Massachusetts looks at that because they're in the midst of updating their swimming pool code. So that would be helpful.
That's great.
That's cool. Talk about it for a long time. Any other questions for our health agent? If not, the chair will entertain a motion to approve her report.
So, good.
I'll make
Second.
a motion.
Motion second, any further discussion? Seeing none, all in favor?
Aye.
5-0, thank you, Marlene. Director.
Yeah, so while we're on the pools, Samantha Hardy is getting trained this week, and is going to become a certified pool operator. So she will be attending Marlene's seminar and be getting trained by Marlene this summer on conducting pool inspections. Also too, our active bystander training for the MRC is tomorrow night. The class is full, so we have 35 participants.
That's great.
Yeah.
That's great.
So one of the things that we did a little bit differently is we opened it up to other MRCs, as far as like, so we could collaborate a little bit more. They've been opening up our trainings, their trainings for us, so we're reciprocating that. We have about 4 or 5 MRC members from Region 4B, so they'll be coming to Burlington to take this
I
training.
think that's fantastic, and I love the fact that you are collaborating like that. That's wonderful. Awesome.
And the last thing, I just wanted to let the board know, so that we have an MRC volunteer who is a nurse at Leahy. And she came to our annual meeting, and she suggested that we look into the Matter of Balance program, because she's a Matter of Balance instructor. So she arranged for myself and Chris to go to Leahy to meet with the nurses at Leahy who do the Matter of Balance program. So we're looking at that as a possibility to do that with our MRC volunteers.
Great.
They're willing to train them to become instructors. They don't necessarily need to be medical people. And they can go and train at Leahy, and then we could run the programs out of the senior center or our office. I believe it's a 6-week program for 2 hours a week that requires 2 instructors. So we would just need 1 consistent instructor for the 6-week time frame, and then we could supplement the other instructor with the MRC person who is trained. So we're gonna look into it, and hopefully we'll get enough MRC people willing to come forward and become matter of balance instructors, so that we can run one or two of these programs per year. And we'll advertise it to the senior center, but Leahy also has overflow, because they don't always have the classes, that they can send people to us to take the class.
I think that's fantastic,
Great.
fantastic. Will there be a health fair table for the matter of balance?
I don't know, we haven't heard back from Leahy yet on what tables they're gonna have at the health fair, so we're still waiting for Michelle Snyder on that, as far as who's gonna be there.
Okay. Good. Any other questions for our director?
Yes, the Leahy Community Needs Assessment Survey and then meeting. We have a survey that's for the community, that's online.
It's on our website, so there's a link from the main page, the town website, to our website, which takes you to the survey. And so if any residents of Burlington should take that survey, and just provide their feedback. We're meeting, there's a meeting tomorrow to discuss it, with, town administrator, fire department, COA, and myself, to kind of talk about the assessment.
And you're on the Leahy Community Assessment Board as well. That's great.
Hey, Mr. Chairman, so do you want to ask a question first?
I just have one question.
Yeah, sure, I'm sorry.
Susan, just the vehicle, just with all the discussion of partnering with the fire department, how is that? I see that you have that warrant article.
Yeah, so
Update on that?
it's been submitted. I don't believe that the capital budget has voted yet on that. We will likely have to appear again before Ways and Means, and then it goes to town meeting in May, so we'll find out in May.
Okay, great.
And
Thanks so much.
backup, we
Sorry.
wrote backup.
Broke up backup material, which is included, and that will be included at town meeting.
We haven't heard from capital budget yet?
I don't know if they voted on it yet. Not
I've
sure if
heard that they
voted.
have been rather supportive, and so has the town administrator. That's what I heard at election day.
Okay.
I can't,
Mr. McSweeney?
Thank you. I just want to publicly acknowledge and commend our staff for what a fantastic job they do. I mean, this meeting alone is just a cross sample of the types of things we deal with, from fairs to drainage to flu, influenza. I mean, amazing. You guys are on top of every single issue, and you keep us looking good, and I just want to thank you on a regular basis.
I agree.
Thank you.
Here,
We
here.
have a great staff.
Here, here. Thank you, Mr.
You really do.
McSweeney.
You're welcome.
Absolutely, we are blessed.
Very much so.
If there are no more questions for the director, the chair will entertain a motion to approve her report.
So moved.
second.
Motion and second, any further discussion? Seeing none, all in favor?
Aye.
5-0, thank you, Director. Reorganization of the board. I'd like to congratulate Dr. Weiner in being re-elected to the Board of Health. Congratulations,
Thank
Dr.
you,
Weiner.
and Dr.
Saltzman.
Goes along with your Alzheimer's.
Thank you.
and,
Thank
Dr.
you.
Saltzman, congratulations.
Thank you.
But, and seriously, I mean, obviously you were unopposed, but like 31 years and
30 years.
12,
This is 2007,
12,
so this is
13 years.
this is my 13th year.
so, great job, and you guys are committed, and,
No one wants to do it.
thank you.
So the chair will entertain a motion for chairman.
So, Mr. Chairman, I will nominate Dr. Ed Weiner for chairman of the Board of Health.
Wonderful, we have a motion?
Oh, so moved.
There's a motion.
Oh, she seconded it.
Oh, I didn't hear. The motion and a second, is there any further discussion? Seeing none, all in favor?
Aye.
5-0, congratulations, Dr. Weiner.
Thank you.
Welcome to the chairmanship. Would you like to solicit, continue, well, actually, the board is yours
Well, I'd
for
like,
vice chair.
I'd like to move that we nominate David McSweeney for vice chair.
So moved.
Second.
Keep going.
Oh, let's get it. If I hear no more nominations, all in favor?
Aye.
Thank you very much.
Thank you.
Vice
Look
Chair.
forward to it.
Wonderful, congratulations,
And with
everyone.
that, do I have a motion
Congratulations.
to adjourn?
So moved.
Done.
Done. We're adjourned. Good night, everybody, and wash your hands.